There are now more Covid-19 patients in the UK hospitals than there were on the day of lockdown in March. At one hospital on Merseyside, there are currently 90 patients being treated. There were only 7 a month ago. Our health editor Hugh Pym has spent the day at Whiston Hospital in Knowsley.
Shirley went through it all in March and April with the surge in patients going into intensive care. And now she feels it's happening again.
This is really real. It really is. It frightens me. We all have to look after ourselves, to look after our families and to look after the wider community. Please take heed of what the government's guidelines are.
The hospital, serving a Merseyside community with one of the highest infection rates in the UK, invited us in today to see just what it means for frontline healthcare. BBC News is donating some personal protective equipment to the hospital. There are now 9 COVID patients here in intensive care, double the number a week ago. A few weeks before it was just 1. That just shows how fast things are escalating and the impact on the hospital.
We've had a really challenging weekend, haven't we? So we know that we're coming out of the weekend with a very busy organisation.
At a Gold Command meeting, the hospital's senior management are told there's been a jump in COVID patient numbers.
We've got 90 current positive inpatients. We've had 13 new positive patients in the last 24 hours.
For frontline staff like Nadine, there's concern at how fast events are moving and the likely pressures they'll bring.
We put our feelings to the back of our minds from the last wave because it was so stressful, and now that we've got this second wave, you know, the anxiety has definitely come back within the staff and within the trust.
You're feeling okay about surgery today?
The hospital's pressing on with non-COVID care. Melissa has come in for a routine operation. Her joints are easily dislocated because of her condition. It was postponed back in March.
Now to call me back in, I am so relieved. Even my carers are. They're just so relieved that it can finally get done and hopefully get some comfort and relief from it.
We are ready to care and we will protect you and keep you safe.
The medical director says they're doing what they can for all patients, but it's getting more difficult by the day.
These last couple of weeks have felt at least as worrying as a medical leader as it did in the first wave. And in many ways, even more worrying, because I don't have the room to manoeuvre within the hospital that is already full and full of really deserving patients.
How close are you to having to cancel routine surgery and procedures because of COVID cases?
We are really close. Right now I've got every operating theatre running, but we risk having to take some of that down.
Back in intensive care, Grace, who has COVID-19, is ready to move out. She wants to warn others about the reality of the virus.
Be fearful of it. Make sure that you do the right guidelines. Keeping yourself safe.
A message which all NHS staff want the public to grasp as they face the bleak consequences of rising virus infections. Hugh Pym, BBC News, at Whiston Hospital on Merseyside.
Well, the latest official figures show 13,972 new infections were recorded in the latest 24-hour period. It means the average number of new cases reported per day in the past week is 14,588. Hospital admissions have also increased. On average, 615 people were being admitted every day over the past week. This number doesn't include Scotland. 50 deaths have been reported. That's people who died within 28 days of a positive COVID-19 test. That figure is usually lower after the weekend. It means on average in the past week 72 deaths were announced every day. It takes the total number of deaths so far across the UK to 42,875. Well, there were warnings today that as the number of new infections continues to increase, the virus is moving further into southern England and also spreading from the younger generations to older, more vulnerable people. Our medical editor, Fergus Walsh, reports.
The Nightingale hospitals in Manchester, Sunderland and Harrogate, set up for the first wave of coronavirus, are now being mobilised for the second. There are more patients in hospital with COVID-19 than when the national lockdown happened in March, and government medical advisors warn numbers will rise.
We have baked in additional hospital admissions, and sadly we also have baked in additional deaths. that are now consequent upon infections that have already happened.
There have been almost no hospital admissions among the under-18s, the flat line there. Now, there's been some increase among those aged 18 to 64, but now look at those aged 65 to 84, a sharp rise in hospital admissions, and even more striking among those aged 85 plus, reinforcing the evidence that it is the elderly who are most at risk from coronavirus, even though most cases are among younger age groups. Many who were never admitted to hospital have lingering health problems like fatigue, so-called long COVID. And then there are all the usual demands on the health service. Much non-urgent care was postponed when the virus first hit. The hope this winter is that won't happen.
Contact your GP if you're worried about cancer symptoms, an unusual lump, for example, or blood in your urine. Use the emergency service if you have chest pain or another acute condition. We are determined to keep that capacity for non-COVID services open for as long as possible. But the key to this is reducing infection rates.
So much depends on whether the rise in coronavirus infections can be curbed. This map shows the rate of change of coronavirus in England. The areas with the sharpest rise in rates are shown in red, and you can see they're not just in the north of England. The epidemic is also growing further south, especially in parts of London and the home counties, even though case numbers are still much higher in the north. NHS leaders warn that within 4 weeks, some hospitals in northern England could be treating more COVID patients than they were in April, and they're urging the public to respect the rules on coronavirus. Fergus Walsh, BBC News.